Hospital vocabulary.
A day in a hospital. In this video, we talk about 3 people who come to the hospital for examination. Young man who has high heart rate. A pregnant woman who feels pain in her stomach. An old man who feels dizzy and has a headache. Heart pain. The young man has a high heart rate and decides to go to the hospital and be examined by a doctor. Blood pressure. The nurse in the emergency room takes his blood pressure and the rate of heart. Sphygmomanometer. Sphygmomanometer. Glucometer. Glucometer. Electrocardiogram, ECG. He visits doctor's office. The doctor examines the man and asks him some questions. At the end of the examination, he writes an ECG test and an abdominal ultrasound. Ultrasound room. Ultrasound room. Cardiography room. Cardiography room. Stomach pain. A pregnant woman feels pain in her stomach and abdominal. She decides to go to the hospital and be examined by a doctor. Maternity units. The doctor visits woman and refers her into the maternity unit to prepare for birth child. The newborn nursery. After a day, woman gets better and goes to the newborn nursery, and female pediatrician gives baby to her mother. Pediatrics department. A few months later, the woman and her baby go to the hospital and the pediatric department for examination. Dental department. After the examination of the baby, it's mother's turn. She goes to the dentist to check her teeth. At the beginning, doctor examines the woman's teeth with stomatoskope, then pulls her tooth with dental pliers. Dental pliers. Dental pliers. Stomatoscope. Stomatoscope. Feeling dizzy and headache. Grandfather and his grandson go to the park. In the park, the grandfather feels dizzy and has a severe headache. Neurologist doctor. After a few hours, grandfather and his children go to the hospital to see a neurologist doctor. MRI scanner. The doctor visits the grandfather and orders a brain MRI for a better diagnosis. Brain tumor and surgery. After seeing the results of the MRI and diagnosing a brain tumor, the doctor orders surgery. The doctor starts the surgery. In the middle of the surgery, 3 additional blood bags are needed. A little later, the grandfather has a cardiac arrest during surgery, and the doctor uses a defibrillator. Cardiac arrest means electrical issue that makes your heart stop beating. Defibrillators are devices that apply an electric charge to the heart to restore a normal heartbeat. Blood donation. The grandfather's son donates his blood at the blood donation center. Other departments of the hospital. Optometry. Optometry. Laboratory. Laboratory. Radiography. Radiography. CT scanner. CT scanner. Pharmacy. Pharmacy.